Hi, my name is Philip Palermo, and that over there is Amelia. She is currently snoozing on her Peapod supportive chair, and she is still hooked up to her therapeutic shaky vest, we call it. It helps shake her airway and helps her breathe a lot better. She has what's called Batten disease, and among other things, it really affects her ability to breathe normally and breathe healthfully. So the shaky vest there is helping her clear her airways. Batten disease is kind of an umbrella term for 13 types of neurological disorders, and that leads to some severe symptoms like a lot of seizures. Amelia herself is on 4 or 5 seizure meds right now to help keep those under control, and over time Batten disease takes away more and more abilities. Amelia, she had been able to talk and walk around 18 months to 2 years old. Batten disease started, plucking those abilities away from her. We have a handful of videos of her saying things like mama and dada before Batten disease took that ability away from her. And she's currently getting an overnight feed with her feeding pump here, and that's going through a tube that leads into a G-tube port in her stomach because, again, Batten disease has taken away her ability to safely chew and swallow food. And what I'm doing today is making a video for Project for Awesome 2025 in the hopes that you select the BDSRA, that's the Batten Disease Support, Research, and Advocacy Foundation. Batten disease essentially is a terminal disease. Of the 13 types, there is only one type that has an FDA-approved treatment. The rest, researchers are still hard at work trying to develop cures and treatments. One of the challenges with rare disease research is there's not a lot of funding. Groups like the BDSRA are hard at work spreading the word about the need for Batten disease research, and they're also supporting families like us, helping us guide us through this journey. They helped us pay for shipping for Amelia's old wheelchair so we could give it to a family after Amelia grew out of it. And in case you haven't heard, shipping a wheelchair across the country is not cheap. It was very nice of the BDSRA to help us out there, and they helped 2 families at the same time there. Also, the BDSRA is helping train medical professionals and get them more aware and more comfortable with Batten disease. The BDSRA is working hard to get doctors around the country more familiar with it and trying to kind of reduce the geographic barriers between specialists that are comfortable dealing with the disease and the families that need them. Elsewhere, they are funding a lot of the researchers that are hard at work trying to develop cures, and so they are very hands-on in helping the day-to-day of the families dealing with Batten disease, and they're also helping to provide hope for us in the long term that we will finally have cures for these awful, awful diseases. They are very rare diseases. In total, for all of Batten disease, we're talking about 2 to 4 births out of every 100,000 in the United States, and that's for all 13 combined. If you break that down into the different individual types, you get rarer still. CLN1, which is Amelia's type. As far as we can tell, she might be the only one or one of maybe 2 currently in Washington State. That's how rare we're talking about. And so the need to fund this research is extremely important. So again, I'm hoping that Project for Awesome 2025 includes the BDSRA this year. And if they don't, that's okay. I will try again next year and the year after that, and so on and so on. Whatever charities you do include, I will be happy to support. And if you're watching this video, I hope you support all the charities because they are bound to be amazing and worthy charities as well. Again, my name is Philip Palermo. That's Amelia. Thanks for listening.